I have lower back problems with my spine and my discs, and I have stiffness and low-grade pain. I was doing manipulations on my back, and he said there's not much more we can do for you. I highly recommend you having these shots done.
You know how sometimes you have a pain, but you just can't figure out exactly where it's coming from? Well, there's good news because Novocur Pain Management Clinics, they can figure out exactly where it's coming from. Dr. Alex Bigham, I am so impressed on technology today and some of the ways and techniques that you use here on how to help patients and pinpoint that pain.
Yeah, you know, the technology in the field of pain management has really come so far, just even in the last 10 years. But in particular at Novocur Pain Management Clinics, we have a lot of proprietary treatments that are just not available to anybody else.
So let's talk about Kevin, your patient, who's he's had many different types of pain management treatments from you, but you worked on his back, and this particular treatment, you're able to go in and find where it's starting from. How do you do that?
Right. Well, you know, through thorough diagnostics, we pinpoint where the problem exists, and then using this type of video fluoroscopy equipment, as they do the procedure, they're able to precisely pinpoint where they're going to place the medication and make sure that they're affecting the tissue that's generating Kevin's pain.
Okay, so let's talk about that medication because as you said, it's proprietary.
Right.
So this is a lot of people are looking for relief, and there are different types of injections out there. How is yours different?
Well, we've come up with a couple of different types of medication options. Of course, we perform all of the entire spectrum of pain management procedures that are available, including all the traditional ones, but we've come up with a couple of very unique procedures. One is a low-dose steroid medication mix. And obviously the advantage of using a low-dose steroid is that we avoid some of the negative impacts traditionally associated with a steroid. There are some negative side effects. We avoid those, and we're able to administer more of the medication in more areas during one procedure. Therefore, we have a much better opportunity at really shrinking down the inflammation that's generating the patient's pain that way. Then we also have a completely non-steroidal medication mix, and that is especially good for anybody who has previously had a traditional steroid injection and they've had a bad reaction. And there's certain conditions that just are negatively impacted by a steroid, such as those with diabetes. It really spikes their blood sugar. There are certain conditions where a steroid is really contraindicated or not recommended. It can make the condition worse. And so that's perfect for those people.
And so in Kevin's case, this is just working for him.
Yeah.
You know?
And if it works for them, that's what's nice about the completely non-steroid or the low-dose steroid. We can just keep on doing it and doing it. There's really no limit to how many times we can perform that procedure on that person. Whereas with a traditional treatment that involves a higher concentration of a steroid, there are limitations. We only want to do so many in a given period of time. Otherwise, we can get some negative consequences from it.
Okay, so you might be experiencing back pain. Here's the thing, we are in the very room this procedure was done in. I mean, there's no anesthesia. He can drive himself home.
Yeah, and you touched on a very important aspect. There's not very many facilities that provide these types of interventional pain management procedures where they're not completely knocking the patient out and putting them under general anesthesia or conscious sedation, and there's really no need for that in our opinion, and we're avoiding exposing the patient to unnecessary risks by not doing that here. And so, for example, in Kevin's case, he was able to get back in his car and drive home because he was not exposed to any anesthesia, just local, just to numb the area, and the procedure is so comfortable. That's what all of our patients say, is this was so quick and it was so comfortable, I can't even believe it. It's nothing like I've experienced before.
No, they really don't hurt. Laying there, I mean, you're a little discomfort, but otherwise, not a problem at all. Coming here, I can have it as often as I need to relieve my pain, and the cost is, with insurance, it's great. I keep doing it because I enjoy feeling better, and it relieves a lot of the, like I said, the mobility and the low-grade pain that I have. It eliminates it.
All right, so I know you want to know more information, so here is how you get in touch with Novocur Pain Management Clinics. They have 2 locations in the Valley. For more information, you can visit novocur.com, or you can call them at 480-855-NOVO, which is 480-855-6686. Thanks for having us.
Absolutely. Thanks for coming.